nursing. A tough, demanding, dirty job. The front line of the NHS. And for 3 trainee nurses, harsh reality is about to hit home.
I'm going to need a cup of tea.
Journalist Janet Street Porter, comedian Shan Hughes and TV presenter Gail Porter survived their first taste of hospital life. Now, with basic training behind them, it's time for the real work to begin.
Oh, I love the smell of urine in the morning.
I'm going to get your mummy now.
You go, push. Oh, no! And what do you do with that now?
Some people take their own placenta home and cook it.
No.
They do.
What are you doing in there? You're supposed to be in here doing things.
It's just, you know, and they're lying there and they can't do anything. And it's...
3 celebrities, 1 hospital, and no turning back. It's 6:30 a.m. and Barnsley Hospital's newest recruits are getting ready for their first shift as auxiliary nurses.
Fertility experts say severely obese women should not be given IVF treatment on the NHS.
Well, I'm really excited, actually, because we just sort of had such a... Oh, I just got it bad. And I just said last night, suddenly it hit me and I went to bed.
Although requiring no formal qualifications, the role of auxiliary is one of the most demanding the hospital has to offer. The new trainees will be responsible for everything from cleaning and feeding patients to assisting in complex medical procedures. Shan, Gail and Janet are about to find out whether they've got what it takes. Gail will be spending her first week on Ward 18, the medical emergency unit.
Gail Porter, I would think, has probably got quite a soft emotional edge to her. That may need some work.
Oh, good morning.
Morning.
How are you?
You all right?
It's
Nice to
fun.
see you again.
Thank you.
Looking forward to it?
Yes, we're all excited.
Great.
It will be a real test for Gail, as it's one of the most critical wards in the hospital, with patient turnover fast and furious. Janet's uncompromising style has already raised eyebrows across the hospital. Now she's been assigned to the maternity ward.
Morning. Morning, everyone.
Where they deliver over 2,500 babies each year.
Hello.
Hello, Janet.
I'm sorry I'm late. I didn't know I had to come...
You are late, 10 minutes late.
Oh, no, but I was here early. Sorry about that. I was not going to get a big black mark, because I was...
We'll let you off, as it's
Technically,
you're a
you're
new
fine.
girl and it's your first day.
Thank you.
For Bachelor Shan, it's the alien territory of the children's ward. And lead nurse Sue Webster has clearly been warned to keep an eye on him.
I just thought I'd introduce myself properly because we've not had the chance yet. So I'm Sue Webster, I'm lead nurse up here. I expect you to sort of function as part of the team.
Sure, yeah.
And I just expect you to come to work uniform properly, smart, tidy, not smelling of alcohol or cigarettes.
Well, except for my hands.
Well, wash your hands
Yeah,
when you come in.
absolutely, yeah.
All right.
OK, well...
And we will make you work hard because that's what you're here to do. So
Sure,
don't think you're coming to get away with doing very little because we'll make
Do
you
I
work
look like
hard.
the type it looks like I want to get away with?
Well, I'm not sure. You see, I've not decided yet. So
OK.
hard work it will be.
Sure, absolutely. Yeah.
OK.
What are you doing with the pencils and the bits of paper?
This is where you write down everything so that you know everything that's happening on the ward today.
First up for the trainees, it's the handover meeting, where the night staff brief the morning shift on each patient's medical history.
In 9C is a primogravida, 37 and 5.
B1 is Amber, she's on acyclovir and Kefridin.
However, the troponin did come back at 0.3.
Information has to be conveyed rapidly and accurately, and it's no place for the uninitiated.
OK, he's eating crisps this morning, he seems all right.
And then granddaughter went to see him yesterday and she found him playing with his fuse box.
Is that a technical term, or is that...
No,
actually... It's actually a proper fuse box. OK, fine.
With so much to learn and so little time, Janet starts with a quick tour of her new workplace.
Hello. Hiya. Birthing ball's a good
thing to use in labour because when ladies sit on birthing ball, the pelvis is at an
That's the same as my exercise ball.
Yeah. I'll show you room 5. As baby's delivered, it's still attached to the cord and placenta, so we clamp the placenta. Sometimes we get dads that like to cut the cord, so this is for cutting the cord.
I thought you were going to say we circumcise them while we're about it.
No, these are cord scissors.
They're cord scissors, yeah, I'm actually looking at them, yeah,
cord.
OK. Right. All we need is a few customers then.
Yep.
Most important job.
Yeah.
On Ward 18, Scott's keen to get a sense of Gail's capabilities, so he starts her with a few straightforward tasks.
Now, on the wards, it would be a domestic that actually does this job, but because of our turnover, because we need our beds quickly, it's sort of become our job and responsibility.
Sorry I'm not a handsome doctor.
Oh, sorry.
You just have to make do with me.
I'll let you get rid of that, Gail.
OK. Wow, someone's been drinking a lot.
Excuse us. Now, all that needs to go down the sluice and just fish away.
Oh, I love the smell of urine in the morning. Might jack him a job. Come and hang around with you forever.
Nice with us.
Yeah, I love it. It's really nice.
Gail's breezed through her first hour as an auxiliary nurse, but it's going to be a long day.
Sorry.
In Barnsley Hospital, 3 famous faces are finding out just how hard life as an auxiliary nurse can be. Gail's learning the sensitive side of the job as she gives her first bed bath.
Do you give them all bed baths every morning?
Everybody that needs, yeah. I mean, this is the essence of nursing care, that you keep your patient clean, warm and comfortable at all times.
Her patient is a 92-year-old stroke victim who has trouble communicating.
Just keep that line intact.
Oh, we've got blood on the bed.
That'll be from when they actually connected that, I think, rather than anything that we've done. But again, we will change that sheet.
Is it all right? Because there's still blood coming out.
Let's have a little look. I think there's just a little bit of leakage from where it was connected. Nothing that I
Nothing to worry about.
Moving the patient has caused him to vomit.
Are you sure you're OK?
Yeah, I'm fine.
You look a little bit...
A bit peaky.
Just a little bit. OK, so... Let me just roll you back, Mr. Scully.
Do we have something to clean him?
I shall swap sides with you for this bit, if that's all right, so I can sort the blood out.
Yep.
All right?
Yes, I'm fine.
That's it.
Watch his
Spit
teeth.
that out for me.
I'll be fine. I'll get a glass of water, I'll be fine.
You don't want to faint on me or anything,
No.
yeah? No.
At least I'm in the right place. Open him up.
Yes. Yep, he's all clean, he's all decent. Now then, just open them, just that back.
That's
so I'm
wrong.
doing the wardrobe on that side.
I'm going to need a cup of tea. Ooh, I think I'm going to need a cup of tea. I feel a bit faint.
Do you want a drink of water?
I think I do, yes.
In there,
Shall I take this off?
Water, yeah.
Excuse me, if I get a glass of water.
Because it's round the clock.
Oh, this person puke on me. Oh. I got a bit upset because it's horrible to see someone that can't bath themselves and can't look after themselves. And it kind of reminded me of, you know, someone. So it was a bit... And then he was throwing up, and it was a bit difficult because I felt really queasy. So you don't want them to feel bad, but, you know, and he couldn't do anything, and his teeth were coming out his mouth, and there was green stuff everywhere. And I was just trying to keep it all together, but I thought I was going to faint.
Oops. Oops.
Sorry.
It's all right. Don't be upset.
I know, sorry.
It's all right for you to feel like this, seriously, it is.
Is it?
Yeah, it is.
I just feel so... It's just, you know, and they're lying there and they can't do anything.
I know.
And it's just...
You know, this is where they say that nurses are hard.
Yeah.
Because this is something that we adjust to and we've got used to over years.
Sorry.
It's all right. Good patient. Seriously, I've got some plenty.
And my gran was so ill in hospital, and I just hate to think, you know, and you just lose your facilities and you just want to...
I feel for you because I felt like that myself.
Did you?
Yeah.
So it's not abnormal?
No, it isn't. And it's sometimes individual patients do that to people. Like some people, it might not bother me.
Yeah.
It would you. And it's other way around.
Well, it's fine because you can wander around and chat to people and you're fine, and then it was just seeing him just lying there and he was looking at me as well as you're washing him, and you just think, what are you thinking? Because you can't tell me, you know, he wasn't speaking, and I just felt so awful for him. But at least he's clean.
Yeah, but you're doing well. You're doing all right.
OK, sorry. Terribly sorry.
Don't be sorry.
OK, I'm back on form. So sorry.
It's bed bath time on the children's ward too.
This is Daniel's mum.
Yeah, we met. Hiya.
We met Daniel.
12-year-old Daniel has cerebral palsy.
Are you going to give me a smile? Go on. I'm going to get you ready and give you a wash.
Sean's job is to assist auxiliary nurse Vicky with whatever she needs.
The other thing we haven't got is some baby bath. We've got baby bath. Do you know where sluice is?
Yeah.
It's in cupboard on wall. Do you mind getting that?
No, absolutely.
Is that all right?
And it's just more or less down there a bit, isn't it?
Just in sluice, yeah.
Okay. Sorry. Do you know where the sluice is? The sluice? The sluice?
Time management is a vital part of nursing, but Sean's taking it all at his own pace.
I haven't got lost, I'm afraid. I'm looking for the sluice. Is it...
It's on the side.
On the other side?
Yeah. It's...
More or less directly opposite this room, on the other side, is it?
Yeah, on the side, yeah.
Brilliant. Thank you. It's 37. 21.
With no sign of the baby bath, Vicky finally puts Sean out of his misery.
Just hanging out, yeah. A couple of... Oh, no, just get...
Baby bath. These are the last two.
Right. They'll come up automatically.
Right.
On maternity, they've just received word an expectant mother is on her way in.
There's a lady coming up, pushing. Get your penny on.
Get me penny on.
It will be the first time Janet's ever seen a birth.
Don't know any details about her at all, so we'll see when she gets here. But if we're ready, then we're ready, aren't we?
At this stage of training, Janet will mostly be observing, but it's also a chance for midwife Kerry to assess her bedside manner. Kerry's asked Janet to offer support and encouragement to 23-year-old Joe McKeegan throughout the labour.
Push, push, push. Well done. Hopefully Janet will be a little bit thrown by this, and she's not seen a normal delivery in the flesh, so hopefully she might get a few surprises.
How often the contractions now? You can't tell.
No idea.
Do you think they're getting quicker?
I hope so.
We're watching now and waiting for it. Her pain should become quite strong quite quickly now.
That's good.
Well done. It's only
You've
one
got
way
this
it's gonna
far.
come now.
There's only one way this baby's coming out. You got to push.
You can do it. You're so close.
Go for it.
No, you need to push, Joanne. Push right down for as long as you can. Big breath. No, you're letting your breath go. You're blowing it out. Hold it. That's it.
Now hold it.
Push, and push. Excellent.
Push.
Well done. Keep it coming. And again. And
One more.
on. Excellent. Big breath in. Right down.
That's it.
That's it. That's better. Well done. Keep it coming, Joanne. Keep it coming.
You go, push.
I can see it now. Go on. Big breath in. Big breath in.
Do you want some water? Yeah, I'll get you some water.
Get your strength.
Yeah. Now have a big push this next time.
In the final stages of labour, Kerry is joined by another midwife to help her deliver the baby. By the end of her 2 weeks, if Janet completes her training, she'll be the one assisting.
Right, relax your legs and pant. That's it.
Right.
Oh, no! No! Congratulations, what have we got? It's a little girl. What have we got? A little boy. Oh, congratulations.
It's a little boy.
Oh, look, it's like Martin. It's gorgeous, isn't it?
No, it's a big boy.
That took a lot of pushing.
Right, darling. You got him.
Put your hand on his bum to keep him safe and I'll get a warm towel.
With a little help from Janet, Cameron James is born. But the midwife's job isn't over. They must deliver and check the placenta.
Right, so examination of placenta is really important because you can tell a lot from that. That's what's fed your baby. The cord should have 3 vessels running through it. Those 2 little tubular things, they're arteries. Them 2 are arteries, them little ones. This big juicy one is your vein. Yeah. So we can see that his cord is good and healthy. So then you look at your placenta. That's a lovely healthy placenta. So there's no problems with that. That's
so what do you do with that now?
And it gets incinerated along with unless parents want to take it home and cook it.
What?
They do sometimes.
They cook it?
You can get menus, different recipes and things for pate or, honestly, for placenta. And some people take it home. They do. They bring a Tupperware dish in.
No.
They do, honestly. And there's some people take their own placenta home and cook it.
But you're having me on.
No, I'm not. Honestly, I wouldn't say it. So that goes into there. I'll get you some recipes and I'll show you.
Please don't. Oh, my God.
Well, I think you did well because you reiterated what I said, didn't you, when I said
I was calm.
Yeah, and you helped with bedding and with water and everything, so, yeah.
I'm not squeamish. I'm a woman, I know where they come from. I know they don't come from under your armpit. I'm just off home to make a placenta pie.
Yeah.
So not making a placenta pie.
No.
On Ward 18, the nurses have 22 lunches to hand out.
Hi, Raymond. Sorry, are you still busy? I know, I can't leave you alone.
You can't leave me alone.
I know, you're just irresistible. I was going to offer you some lunch.
Gail's responsible for 7 patients, and speed is of the essence.
Fish and chips? Everything I didn't offer you fish and chips. Steak and kidney pie, chicken casserole, minced bolognese or tuna. What about chicken casserole?
I'll have some chicken casserole, man.
Just chicken casserole?
I don't want to get a pile.
You want what?
I don't want a big pile.
Oh, OK, fine. I'll come back in a minute with your chicken casserole, ice cream and a cup of tea. How about that? Stop, let go of me. It's me, you're irresistible. OK, sorry. You done?
Yes, just get my next on.
Oh, we clearly need to speed up a bit then, don't we?
Sorry. Am I getting into trouble?
No, you're not getting into trouble.
Oh.
You've got to stop thinking that you're getting into trouble every single time that I'm taking you.
Sorry.
At times, you know, when we go into a room and we've got something in mind that we're doing, we are going to a bed to do something, you have a tendency to sort of like be moved off by other people in the room.
Oh, see, yeah, I know.
Bedside. You just need to bring your focus in just a little bit. Good stuff, right. Come on then, let's get going. Let's go and see some people.
OK.
There you go, you survived your first day, well done.
into play. You're having me up.
Janet and Gail head home, but Sean's on a later shift and still has 4 hours to go.
Now, is there anything I need to do when you're gone, besides sleep? Sorry, can you say that again? Concentration levels are really high, and now, because I've just had a little break, I'm shattered because I'm not thinking of anything. So it's a bit like, whew.
Nurses get just one 15-minute break per 8-hour shift, and Sean's already had his. But with a new ward sister just come on duty, Sean grabs his chance.
Yeah, I wouldn't mind getting a bit of fresh air as well.
Right, you'll go for your break then, and we'll do everything. We'll do it when you come back. Yeah, you'll go for your break.
Well, I must admit, for someone who wasn't a fag for 6 hours again, I'm not really enjoying it. I better get back up there and have a tic-tac.
Sean needs to remain focused as there are 2 late arrivals on the ward.
Here we go, 1, 2, 3.
Yeah. Hey! You're like the king, being carried everywhere.
5-year-old Callum and 15-year-old Christian have both broken their arms.
It makes it better quicker.
It's a chance for Sean to learn how to take readings for blood pressure.
Put it so that back bit's under his leg there.
OK, Christian, just move your leg a little bit, don't worry about it.
That's it, and just wrap it round. Right, sweetheart.
Obviously, you'll feel a bit of pressure now, so don't worry about it.
Turn it on.
Yeah. And then start. And then it's basically the breathing.
Right, just press start again. That's it. OK. It's downstairs. This is what the other side.
This is unplugged. Sorry, it's just a machine, don't worry about it. I was pushing the blood pressure thing going, this doesn't seem to be budging. Little did I know it's plugged in. You know, I've done my 8-hour shift, had 2 tiny breaks. I am knackered now. Done.
It's been a long, difficult day for Sean. And tomorrow, it's going to get worse.
What's he doing in there? What are you doing in there?
Sorry?
What are you doing in there? You're supposed to be in here, assisting sister.
Janet, Sean and Gail are into their 4th day as auxiliary nurses, and new challenges await them on the wards. It's a big day for Sean. This morning, the children's ward have sent him down to day surgery to look after the young patients going through theatre.
He'll be on duty from 8:15, admitting the children, taking them through into the anaesthetic room. When they're asleep, he'll follow them through into theatre, then out into the recovery room once their operation's over, and then into the discharge area and help them prepare for going home.
With all patients in and out in a day, the surgery team can see up to 12 children on a single morning's list.
Hiya. Morning. Morning.
But this well-oiled machine is only as strong as its weakest link.
I believe you're looking for us.
All right, nobody's telling me anything. They told me to go to floor 7. I looked up for myself.
I think it's Shan you're looking for.
So what's your name?
Julie Inchliff.
Julie?
Julie, yes.
Pleased to meet you.
Johnny Chapel.
Charlie?
Tony.
Tony?
Yeah.
Right.
Hiya.
Sure.
Hi, Sean.
So what do you want me to do?
Right.
You have to get changed first.
Right.
Decked out
You're
like
coming
me.
into operating theatre, do you know that?
Yeah.
Right.
And you're going to learn how to scrub up for an operation.
Absolutely.
Excellent.
Looking forward to it. All right,
Tell you
I'm
that
going
you're
to
in the changing room then.
And now we're going to rob a bank?
Yeah.
In theatre, hygiene is paramount.
You must always keep your hands above your elbow.
At all times?
At all times, because if your elbow goes above your hand, then theoretically the dirty part's going back into the clean part.
If Sean makes a mistake, he'll have to start from scratch.
One of the important things now to remember is once you start, you can't use your hands for anything.
OK.
You start off one hand underneath, Don't go back up. You'll have to start again at your hand now.
Right, so
if it's hand above your elbow.
Right, at all times?
At all times, yeah. And then run it all the way through, and then as you get to the end, bring it out. That's it.
Right.
And then do the same with your right hand. Hand above. Excellent. Right. Making sure that you're not touching anything with your hands. Yep. Then you need to use your elbow.
It's just this one, yeah?
Yep. Put it into your right hand.
No, so keeping the elbow.
Yep.
Right.
You want to get quite a few pumped, yeah? It's all right. And then start washing your hands.
Like this?
Yep. Backs of your hands.
Oh, nearly.
Yep.
Takes a bit of getting used to this.
Excellent. Now we're going to proceed down your arm.
OK.
So, pump.
Top.
You just touched it.
So shall I start again?
Yeah, you'll have to start the whole, yep. So rinse your hands off.
Right, I put my elbows down for because I'm going to go for the whole thing.
Yeah. Touch your tap then. And bring, no, you'll have to go through again.
Oh, I'm sorry.
Yeah.
The busy morning in theatre starts in just 10 minutes.
Yeah, you'll have to start again with the scrub.
OK. So we're starting from the outside. So it's... Right, OK. I felt really frustrated that, you know, it's a thing as simple as washing. I was finding it very weird that I couldn't do it, really.
You'll have to start again with the scrub. Because you went like that and then you went back up.
It's a bit like, you know, those things in the fun fair where you try to do the electric thing. And that's the only thing I could equate, and going back to the start again.
You're supposed to spend at least 3 minutes doing it, not more than 5.
Right. And we've been, what, 2 hours?
About 20 minutes.
With his hands finally cleaned, it's still not over for Sean.
If I touch something now, do we go right back to the beginning?
Yes.
That ain't really concentrate now. You look really uncomfortable bending down. You can stand up.
No, but it's just the first time doing it. I want to do it like that, just to make sure that I don't make any silly mistakes.
You can pick it up. It's not a problem. You don't have to be really.
Yeah, but I know them when you go, no, you touched the door. After going through all that, I do feel like I should be allowed to operate.
Well done.
Yep.
Well done. I don't think so.
Oh, you didn't foul yourself.
25 minutes to wash and put a glove on.
They inevitably will get it wrong several times over and have to do it all again. But he just looked so uncomfortable as well. He just looked so wooden. And he was just bending down into it. He just didn't look relaxed at all. And sweating. Terribly.
Finished.
Right,
Well
tea
done.
break.
A midwife's job is more than just delivering babies.
We know he's past urine, don't we? But as yet, he hasn't done a dirty nappy. I don't think so. No. There may be a treat in store for you now.
Once born, the babies need changing, feeding and bathing.
We could perhaps redo this side a little bit, Janet. There's a bit of a gap there, can you see? Because if he does a dirty nappy and there's nothing there, it'll just fall out the side.
And Janet needs to get to grips with it all.
And then you'd put your top on and you give it a shake then. That's all right. That's it, and then give it a shake. Just a gentle shake, that's it. Make sure your top's on properly. That can happen. So, right. OK, so your top's not unscrewed on properly, but there, that's it.
Now, you're going to keep him above the water, obviously. So you're going to leave that hand where it is.
Yeah.
You can drop the right one, very gently.
Your bum was white by Janet Street Porter. Yes.
On Ward 18, there's concern among the staff after Gail's difficulties yesterday. But for a nurse, bodily fluids are a fact of life, and Gail must learn to cope.
We've got a chap who's quite poorly, and we're going to need to measure the levels of oxygen and carbon dioxide in his blood more accurately.
Today, she'll be assisting consultant Richard Shepherd as he inserts an arterial line into a patient's arm in order to monitor their blood pressure.
About a half-an-hour procedure, and then quite a lot of intensive nursing after it, so...
Really? OK.
OK.
Is it this gentleman here?
That gentleman there, yeah.
Dr. Shepherd must insert a thin tube into an artery. It's delicate work, and Gail's job is to stop the patient's wrist from twisting and causing artery damage.
Bring his hand like that so it makes it difficult. No, don't touch his hand. Okay. Scott, we're just going to have to clean that again. That's all sterile now.
Oh,
so
sorry.
if you touch it...
Then you've got to do it again. Sorry.
It's all right.
You right, Malcolm?
Yeah. Right, Scott, that one's working. You're getting good out. Business for that?
I am really proud of myself. I could see them all looking at me. And even when Dr. Shepherd said, Gail, you should just come and hold this really bloody arm while there's blood spurting out everywhere. And I was like, not a problem. Go on then, bring it on.
You're not too squeamish there, then?
No, I'm not bothered with blood.
A lot better than you did yesterday.
No, it's just that green stuff. That just threw me.
Achilles heel, that, isn't it?
Yeah. But I'm sure he wanted me to faint this morning with 2 hours of blood and I didn't. He was pissed off.
Peace.
OK. We're going through the scrub room.
Shan's moment in theatre has arrived.
Where's the operating theatre?
We're in it.
They're actually doing the operation here?
In here. They'll wheel you through on a trolley.
Right.
And this is where, yeah.
He'll be acting as circulating nurse during 4-year-old Ewan's ear operation. It's not the most glamorous role, but it's crucially important.
Get rid of the state towels from Shan, just shove them into rubbish.
The surgeon is scrubbed and he can't touch anything that isn't sterile.
OK?
So Shan will be his second pair of hands.
Unplug in. Get behind it. And just push it forward. So you're going to recovery now, Shan?
Good shot.
Operation over. Ewan is moved to the recovery room.
Spin that pillar over. Yourself there.
Ewan?
You can get him laid on his back and get him sat up, he might settle a bit more.
Oh, yeah. You OK?
No.
Oh,
Shall we get your mummy?
We're going to get your mummy now. We're going to get your mummy. Oh. Go on, Ewan. Lay back for us. So he's still, he's awake, but he has no idea where he is.
Oh, bless him.
He's wriggling a little bit. Ewan, look who's here. Ewan, look.
Hello, it's Mummy. Hello. Hello.
You're a bit upset at the minute.
Hello.
Oh.
You've been very brave.
And it seems Ewan's not the only one who wants to go home.
Janet's gone for a cup of tea because the pressure was too much. I'm not quite sure if we'll see her again for the night. Midwife's reporter. Look at this. A 10-minute break that's lasted 30.
I answered some emails. Oh, Mary, don't make me bath any more babies. When Mary left the room,
Patients to see.
Patients to see. Why aren't they asleep? Why haven't you given them sedatives? I'm sure I've got some in the handbag.
She's very hard. Come on. We've got ladies in pain. We've got to do a drug round now.
It's the nightly medicines round and a chance for Janet to get reacquainted with some old friends.
Oh, I've had most of the things in here. Hang on. Hold up.
Janet, don't disclose anything that you don't want the whole nation to know.
No, that's these. No, I've had that.
Hello, do you fancy anything to eat? Turkey salad okay for you? Leave it up here. Was that be all right for you?
The pace of nursing is starting to take its toll on Gail.
I may have. I've got sore throat today. I've got an infection in it.
Oh, no.
Yeah, I've been at A&E this morning.
You never have?
I have.
From your blister?
Yeah, it's gone all fat. My ankle, I couldn't walk this morning.
Oh, dear.
Agony. That's why I keep flipping my shoes off the back, because it's so painful.
Scott's been monitoring the progress of Gail's blister, and he's starting to get concerned.
I'm going to just stick a little dressing on the back of Gail's foot.
What's it you said it was called?
It's called Gelinet.
No, the thing they said my leg was, because the guy said told me, but I couldn't remember.
Cellulitis.
Cellulitis. I thought he told me I was fat.
Will you then, Nurse Porter, lift that foot up so I can stick this underneath?
Nurse Porter.
Nurse Porter. It's very unlikely that this will stay on for a long time.
Is that me?
That's you.
Thank you very much.
Okay. Might just cool it down a little bit, that, but it definitely needs something over it.
Yeah, because it's really it's burning hot.
Oh.
Thank you very much.
Gail's soldiering on, but as the shift continues, her blister gets worse.
I actually really do genuinely think that at this point, because you're uncomfortable, in pain, and that looks a lot more inflamed than when we started, it might be an idea for you to actually go home, rest it up over the weekend.
Sorry, boss.
It's all right.
They're sending me home. He looked at my wound, and I think they think it's much worse than it was, which actually, to tell you the truth, it's in agony. It's burning hot. But I don't want to go home. I want to stay till the end of my shift.
I think it's only in Mexico now they don't let you have a break within 6 hours.
Having impressed in the first operation, it's a step up for Sean as he escorts 12-year-old Aaron to the anaesthetic room.
Here we go, this is Aaron.
Hi, Aaron. You all right?
The anaesthetic is the most dangerous part of the operation, and it's vital to keep the child relaxed. Today, that's Sean's job.
Aaron, what age are you?
12.
12. And what football team do you support, Aaron?
Barnsley.
Do you? Good on you. I like people who support the local team.
Right, this is the oxygen bit first. Think about something nice.
Barnsley winning a football game.
Hold it on properly then, not with a finger.
Otherwise we'll all
Like
fall
that.
asleep.
You got it.
See you later, Aaron. Have a good sleep.
Right, now, we'll see you soon. Not be long now.
Sean spots his opportunity.
See you later, guys, yeah?
The operation gets underway, but there's no sign of this circulating nurse.
You're supposed to be in here doing things. What are you doing in there?
Sorry?
What are you doing in there? You're supposed to be in here assisting sister.
We're nearly finished.
Yeah, this patient's nearly awake and gone home.
He did notice straight away that Sean had done a runner. To be part of the team, you've got to be there all the time. He should have really been there, and it was noticed that he wasn't.
I honestly am really tired now. I kind of work different hours to nurses.
With Sean exhausted and Gail sent home, it's left to Janet to fly the flag. And even that's about to go wrong.
I wanted to cry when you said you were bored. Oh, darling, no. I'm bored. It was a boring bit.
As the first week nears its end, Gail's been sent home to nurse her foot, but for the other trainees, there's more hard work. Next week, we'll see a big increase in responsibility, so they need to start proving they're ready for the next step. The labour ward is one of the most unpredictable environments in the hospital, and no two births are quite the same.
We got a message to say that Isabel were delivering in car park, but when we got down, it was just that she couldn't get out of the car, so we came down all prepared with his delivery pack. She's still in one piece.
In her first birth, Janet impressed with her bedside manner, but lead midwife Jane wasn't there to see it.
She looks like she needs some pain relief. This is it.
Okay.
Okay.
Now she's keen to assess just how much Janet has learned.
How often do they come in now?
19-year-old Isabel's contractions have been going for over an hour. And as the clock ticks on, Janet's patience is wearing thin.
Go on then, do it again then.
Right, there you go.
I feel great. Is that what it says?
Sean's first week on the wards has been an up-and-down affair. But it's a new day and a new attitude.
Should we do the skidding?
He's going to be assisting staff nurse Barbara Burnage in taking a blood sample from Leona, a 5-year-old suffering from an infection in her hip.
Oh. Hello. Absolutely.
Do you want to sit on our big bed? Just wouldn't mind standing, and then we just had a nice firm grasp around.
Like a tourniquet.
Like the tourniquet, yeah, that's absolutely right.
Distraction therapy is an important part of paediatric nursing. Sean needs to keep Leona entertained while still assisting Barbara.
Have you got any animals at your house?
2 dogs, 2 cats.
I've got 2 dogs as well. What are your dogs' names?
Ty and Tia.
Oh, mine are Betty and Sweet. And I got them from that very famous place called Battersea Dogs Home.
Oh, wow. Well done, sweetheart. Thank you.
Pleasure.
Thank you.
So,
Well done, Leona. Shall we find you a sticker then? Yeah, you were brilliant then, weren't you?
Yeah.
right, you ready? Fast. Fast or slow? Which way are we going, left or right? Should we go the long way round or the short way? OK, OK.
It's taken a while, but Sean finally appears to have won round lead nurse Sue Webster.
Today you've demonstrated how much you have learned over the past few days, because you've not stopped since you started shift today. It's, you know, you've not stopped in the tasks and the duties that need doing, and also the interactions with the children as well. And you've certainly, you know, got a skill at building up a rapport with the children, and clearly they love you.
The miracle of childbirth is making a big impression on Janet Street Porter.
You want me to feign interest? I think of a lot of other things I'd rather be doing on a Friday.
Thankfully for Janet, the exciting bit is here at last.
That's it, go on. Pump now, pump. That's it. This baby is desperate to come out. So nearly done it.
That's it, that's it. Go on again.
Congratulations. Oh, look at that.
Time are we on, Janet?
6:40.
Exactly.
She is a big baby. There you go. All your own work.
Well done.
But Janet's job isn't over.
How on earth do you do that bit up? Right, I'll come to that back to that in a minute. And I think it's like a duvet cover. When I've got her in it, I'll pick her up and shake her a bit, and hopefully it'll all pan out. And I've done it, I've done it. Yeah.
Is it Grandma or Nanan? Nanan, well.
There you go.
Janet may have won over the parents, but Jane's far from impressed.
Well, Janet seems to have got a really short attention span. She looks really interested in something, then after 10, 15 minutes or so, she's bored, and that's probably why she's got through 4 husbands. I wanted to cry when you said you were bored.
Oh, Jane, darling, don't know. I'm not bored. It was a boring bit. There was a boring bit. I wasn't bored. When the baby was born, that wasn't boring.
No.
But there was a boring bit. I'll admit it. There was a boring bit. Just lying.
No, I don't agree.
You know, I think to myself, I can't believe I'm getting paid this good wage for doing something I love, really. You know, I felt quite sloughened that she said she was bored.
Janet, Sean and Gail have finished their first week as nurses at Bardsley Hospital.
I asked around and I found out that auxiliary nurses get £200 a week, which isn't very much.
I mean, obviously I've got a limited amount of interest in babies, but what is really interesting is seeing people who are really committed to their job, who don't judge people.
I dread when I have to walk from the residence to the hospital. There's a quite feeling of dread of, you know, long shift and what might occur.
I have surprised myself because I was a bit worried about how I'd cope in certain situations, and so far, touch wood, so good. I've only nearly passed out once.
They've made it through the first 5 days, but a tough job is about to get even tougher. Next time, they'll be dealing quite literally with matters of life and death.
I've never seen anyone die. Right.